from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. Do you need another excuse to drink a cup of coffee? If so, listen up because you'll want to hear this. Joining us this morning to explain is Baptist Health Cardiologist Dr. Scott Davis. Good morning to you.
Hey, how
Dr.
are
Davis.
you?
I'm doing well. How are you?
Great. It's good to sit at the big guy table.
Dish.
I know.
You're
it's like
important this morning.
It's like a Thanksgiving, you know, and you get to sit
without the food.
with the
without
adults.
good food.
That's right. That's right. Okay, so a new study just came out of a group out of Melbourne, Australia, looking at over 400,000 people over like a 12-and-a-half-year period. Average age was 58 years old, and it continued to show the benefit of coffee, daily coffee intake. This study was different in that it broke down then like ground coffee, instant coffee, and then decaffeinated coffee. And it then measured, you know, did you drink no coffee versus 5 cups a day? And it showed this kind of this bell curve benefit of between 2 and 3 cups a day showed a distinct decrease, a statistically significant decrease in new onset of heart disease, new onset of heart failure, and here's the thing, new onset of rhythm problems like atrial fibrillation. But the interesting thing was the decaffeinated subset was not associated with reducing your risk of developing a rhythm problem. So oftentimes we think, oh, I got a rhythm issue, I need to back off my coffee. And this actually speaks to the other side of it. Now, this is an observational study. We often say that, look, more data is needed. We're going to need to do more study. But this idea that coffee and the heart don't get along, we're continuing to kind of debunk that. Am I going to start prescribing coffee to my patients? Of course not. But we do know that it's not a negative thing. It doesn't have a negative impact on your heart, and it may prove to be beneficial in protecting the heart as far as developing new onset of blockage issues, new onset of heart failure issues. What's the mechanism of action? I mean, how does it work? We don't really know yet, and that's where we need to do more studies. I mean, we know that caffeine, for instance, has some certain benefit on the micro level, like on the cellular level, as far as the way it affects the tissue on the inside of the heart circulation. Maybe there's some protective benefit on, you know, the metabolic syndrome development, but we don't know that. And so it often begs the question when you have these observational studies, you know, is coffee associated with healthier living, or do people that try to live healthier lifestyles just drink coffee, right? So there's more studies will evolve, but the take-home message is that more and more data supporting coffee is not a negative impact on your heart.
Well, look, I'm sure a lot of people are excited as they're pouring their cup of coffee this morning, but as with anything, there is moderation. So that doesn't mean pour 8 cups, correct? How many cups would you equate
That's right, yes. So it seems to be the sweet spots between 2 to 3 cups a day. They looked at it out to 5 cups a day, but you're right. It doesn't mean you drink 5 pots of coffee a day either.
Well, I know I'm happy to hear this. Melinda has kind of garnered me into the coffee realm, working on mornings. And then, you know, at one point they were saying the same thing about chocolate. And then I know, you know, those are kind of in the same avenue when you think about that.
That's the whole further study piece of this, because we don't know, like, what particular component of the coffee is providing such benefit. Again, observational studies then lead to what we call randomized studies, where you take large numbers and study the coffee group versus the non-coffee group over a period of time.
Dr. Davis, always a pleasure having you on with us. Thank you so much for coming on. Let's check in now with meteorologist Melinda Mayo for a check of weather. And look, Melinda, you're trying to get me to drink more coffee. Dr. Davis says you're doing the right thing.
Okay, that's a good thing. It's for your health, right? Yeah, and I think it's this shift more than anything that gets us to be coffee drinkers.